Welcome to The Topic, where we highlight Houston Community College, our students, our programs, and our reach into the community. You're stuck with me today. I'm Parrish Murphy, your host for today. You know, November is National Apprenticeship Month, and HCC is celebrating with a new memorandum of understanding with Harris Health from the REACH Apprenticeship Program. Now, apprenticeships are one of the oldest forms of job training. Now, internships are kind of similar, but there is a distinction between internships and apprenticeships. An internship is usually short term, ranging normally from 1 to 3 months, whereas an apprenticeship is normally much longer, normally 1 to 3 years. Our first guest is the president of HCC's Coleman College, Dr. Philip Nicotera. How are you today, sir?
I'm good, Parrish. Thanks for having me.
Always good having you, sir. Always good having you. Well, now you just held a memorandum of understanding ceremony between HCC and Harris Health System at your campus yesterday. First off, congratulations for that. And secondly, just tell me a little bit about that.
Well, we're very pleased to have that partnership. Long time in the works to get there. A lot of individuals involved in getting us to this point. But it's an apprenticeship between Houston Community College and our patient care technician program and Harris Health. So we'll be training patient care technicians that will end up doing their apprenticeship at Harris Health and then hopefully working there.
Okay, now that sounds awesome. Now, the REACH program, what jobs will it actually cover? Because, I mean, you know, when you're dealing with health systems, and I know you guys do a great job of partnering with people, what specific jobs, or can you just kind of ballpark the jobs that it will cover?
In terms of patient care technician or overall?
Overall.
Okay, so I know that later you're going to interview Dr. Robinson. We've been doing apprenticeships in so many areas, in certified nursing aid. We're looking at doing them in phlebotomy. We're doing them in phlebotomy. We're looking at doing them possibly in surgical technology and in sterile processing, and we can even look at doing them in nursing. So I think, you know, there's tremendous potential to do them in almost all of the healthcare fields and outside of other fields outside of healthcare.
That's great. Now, the REACH Apprenticeship Program, can you tell me basically what Harris Health will provide and what HCC will provide?
So that's, I think I'll give you a very straightforward answer. So we have a patient care technician program. We're the experts in teaching the program. That's what we're going to bring to the table. Harris Health are the experts in having and being able to give the students the hands-on experience that they need. And so in order for these programs and for these students to be educated, they need the didactic as well as the hands-on training. So it's really a nice marriage between the two organizations.
That sounds great. Now, I understand that the first apprenticeship program is for patient care technicians. Will you tell us exactly what a patient care technician does and why is there a growing need for them in the healthcare industry right now?
Well, okay, so great. I'm going to answer the last part first and then go back to the first, if you don't, to the beginning.
Absolutely.
So number one, there's a tremendous need for all professions in healthcare right now. Post-pandemic, we're seeing a need for more than 50% of employees in healthcare as we go, into the next 5 years. So I think that sets the stage that, patient care technician is one of those professions in which there's a need. So I think there's different ways to answer patient care technician. Each organization may use a patient care technician in a different manner, slightly in a different way. And so it's more adapted to how the organization wants to use them. But in general, a patient care technician is involved in the intake of the patient, perhaps doing some vital signs and some other minor functions to get the patient ready to either see the nurse or the physician.
Okay. Now, how long does this apprenticeship program take, and how soon can an apprentice graduate and actually start their career?
So apprenticeship takes 1 year. And we will start in January. And so once they're finished with their apprenticeship, they're ready to go to work.
Okay. Now, I remember you were on a show and not too long ago with me, and you talked about different partnerships with HCA Houston Healthcare to produce, more CT technicians. Why do you feel it is important to develop these types of workforce partnerships?
Oh, great question. And I think one of the other guests that's going to be on later on, Omar Reed, we've talked about this numerous times. The healthcare market for employees and educating training and educating employees has changed. And so it's time that we can't wait sometimes for the traditional methods because they take longer to get graduates out into the workforce. So it is now time, and because of the large number of job openings, it's now time for us to really look at how we train differently and how we can do things a little bit quicker. And that requires a partnership between both the healthcare organization and the educational organization. And so it's really changing our mindset from the traditional way of doing things.
It sounds good. Now, if a person is interested in becoming a patient care technician and participating in the apprenticeship, who should they contact for more information?
Well, I think there's two places that they can contact. Number one is they can contact our advising center at Coleman College. We'll be happy to help them there. And I think they also can contact our apprenticeship department at HCC, and they can get help either way.
Okay. Now, what do you believe will be the impact of the patient care technician program for the apprenticeship and for, Harris Health?
Well, I think the impact is really going to be very positive because they will get well-trained patient care technicians coming right out of the gate. And I think that's important because they're going to do their training at Harris Health facilities. And so when they do that, they become acclimated to how Harris Health takes care of their patients. And in many cases, when you hire someone straight out of school that really hasn't done any training in your facility, there's a little bit of a learning curve on how you run your organization. So that's a definite benefit. I think the second benefit is going to be that as we're successful in this, there will be other fields that we can begin apprenticeships in and follow the same model.
That sounds good. He is Dr. Philip Nicotera, president of HCC's Coleman College. Always great talking with you, Dr. Nicotera. And thank you so much for your leadership and all the great things that you're doing and outstanding work that you do over at Coleman College. Thank you so much.
Thanks, Parrish. Appreciate it. Take care.
And coming up, we'll dive a little bit more into the Reach Apprenticeship Program. Don't touch that dial or that remote or the computer screen or whatever you're doing.
Sometimes what you need just shows up. Houston Community College has your back, whether you're knocking out some basics or upping your game for a better job. Enroll today for spring classes and frame your future with HCC.
For more than a year, we have kept you informed with more than 500 remote episodes. But now we're back, bigger and better with more news and more guests. Join us live every weekday at 10 a.m. on Facebook and YouTube, and on HCC TV at noon and 5 p.m. You can watch from anywhere. We go where you go.
Welcome back to the topic. We are talking about the new REACH apprenticeship program between HCC and Harris Health Systems. We're joined by Dr. Christina Robinson. She is Executive Director for Work-Based Learning, Contact Training, and Industry Partnerships at HCC. Dr. Robinson, how are you doing today?
I'm doing well, thank you.
Thank you for being on the show. It is great to meet you today. Now, Dr. Robinson, will you tell me how HCC and Harris Health became partners in the new apprenticeship program?
Sure. Well, it was a fantastic opportunity. Harris Health had already been doing some work with Houston Community College, and we had this really amazing opportunity to say, hey, let's not just do training, which we've done and we know we can do well, but let's actually integrate training and work together. So Harris Health and HCC, we sat down, and over the last 6+ months, every week, we put together a schedule to say, hey, what is this going to look like? Who needs to be involved? How is it going to work? How many people do we want to have? And at that point in time, Houston Community College, Harris Health, capital idea, the three of us went forward together to say, we know what students need to be successful. Let's get them recruited, get them hired, and get them jobs immediately and get them to work.
Okay. Now, why do you think apprenticeship programs are becoming so much more popular in the workforce, particularly in the health field?
Sure. Well, as our earlier guest said, huge need. Over 795,000 nurses are needed right this minute. And so the only way to impact that growing need is by building a talent pipeline. And the way we do that is we start with our right at the bottom saying, okay, certified nurse aides, let's get them trained. And then what can we add to them? Let's add phlebotomy. And then what else do they need? They need EKG. Okay, so now they're fantastic generalists. So we're really linking together all the things that a nurse is going to need to be successful. Pardon myself, not a nurse, but a patient care assistant was going to need to be successful, both with the patients as well as with the operations. But more importantly, what they're going to need to be as effective as possible and be able to move quickly throughout the organization, whether they're in the ICU unit or ER or wherever it is they might be.
Why is there such a shortage in the medical field? Did COVID run a whole lot of people off?
No, it's a tough job. I mean,
that's
dealing
true.
with patients every day, the work hours, the load, it's a tough job. You have to love people, you have to care about people, and you have to understand that it's a commitment. And so, I think during COVID, we lost a lot of people in the healthcare field. And now we're really rebuilding that because the population is growing and we need people to support that population growth.
Is the REACH apprenticeship program open to Harris Health employees, or is it just open? And also, is it open to people in the community?
Yes. So, it's fantastic for Harris Health. They're not only upskilling current employees, so current employees have the ability to apply for the program. And then we've gone out into the communities, churches, high schools, you name it, to say, hey, who's interested in having this amazing opportunity with Harris Health? And I think it's important to note that these individuals come in day one with a job, with benefits, with wages. So their entire year that they're with Harris Health, they are being ramped up to be long-term employees.
That's great. And the great thing about it is, the fact that they can move up, that will obviously keep people interested, if they could just do something to better their situation as they go. Because you know what? Every 10 years you change, and you need something different, you need something more. So it's really great that you guys do that. Now, if a person is interested in becoming a patient care technician through the REACH program, who exactly should they contact for more information?
Sure. So they can go to hccs.edu/apprenticeship. That's going to take them to the Houston Community College Gulf Coast Region Apprenticeship Hub, and they can actually select the drop down. It says Patient Care Technician REACH, and that's the REACH program. They'll come straight to our recruitment team. Our recruitment team will follow up with them in about 24 hours, and we'll get them over to our partners to get them interviewed, processed, and lined up for interviews.
Great. Now, how long does it take for them, if they want to move up in their current position, or how long does it take for them to finish the program and actually hit the ground running?
Sure. They're actually hitting the ground running immediately, because remember, they're being hired as employees. So day one, they're an employee. So they're going to training. They're going to go into our CNA program first, those courses. But while they're in that CNA program, they're actually working on the job concurrently. So they're hitting the ground running right away. And as I said, they're going to be adding on phlebotomy, EKG, and then learning that whole time. So by the end of 1 year, they would have all 3 items.
That's great. So it's basically win-win. I mean, they get the students, and then Harris Health is able to groom their employees, the way they need to groom them and get them ready and prepared for how they want them to actually work and benefit their pipeline and their programming. That is absolutely awesome. That is awesome. Please come back and let us know, how things are going and things of that nature. We'd really love to hear from you again.
Of course. Thank you so much.
That is great. She is Dr. Christina Robinson, Executive Director for Work-Based Learning, Contract Training, and Industry Partnership at HCC. That is an extremely long title. Can you put that on a card? Does that fit on your card?
We do it all. We take care of talent solutions. So.
Thank you so much, Dr. Christina.
Thank you so much.
Thank you so much for being with us. And we're going to learn just a little bit more when we come back. Stay tuned.
Sometimes what you need just shows up. Houston Community College has your back, whether you're knocking out some basics or upping your game for a better job. Enroll today for spring classes and frame your future with HCC.
When I was your age, I was just like you, fascinated by stars. But now I get to search for life in the universe. And who knows, maybe life is looking for us too.
So we're like aliens to them?
Yeah. Does anyone want to be a scientist now?
I do.
Awesome. We need more girls in STEM.
Maybe we can find aliens.
Things could be stranger, but I don't know how. I'm going through changes, through all of the strangeness. I'm going through changes now.
Hey, welcome back to The Topic. Our next guest also know a great deal about the Reach Apprenticeship program between HCC and Harris Health and the Harris Health system. He is I want to make sure I get this right. He is the Harris Health Executive Vice President and Chief of People Officer. Did I say that correct?
Executive Vice President, Chief People Officer, not and, but yes.
Okay,
it's all right.
No, and okay, I was just curious because people officer makes me think of law enforcement. His name is Omar Reed, and the Director of Talent Acquisition, Ellie, and I want to say your name correctly because my superpower is destroying names. Palugna.
L, just like
L,
the letter.
Palugna.
Yes, Palugna.
All right, welcome to the show, El.
Thank you.
All right, now, El, I want to start with you first. Harris Health System is a long-standing health institution in Houston, but some people might not be familiar with the name. Tell us a little bit more about Harris Health System and the different sites and some of the services that you guys offer in Harris County.
Yes. Well, first off, thank you, Parrish, for having me on your show today. But Harris Health System, we have Bentop. Bentop Hospital is one of our level 1 hospital, trauma hospital, which is in the medical center, right across from the Houston Zoo, so you can't really miss it. And we also have LBJ, Lyndon B. Johnson Hospital, which is a level 3 trauma center, also in the Houston, closest to the 610 area off of Kelly Street. And we also have outpatient clinics and ambulatory clinics around the Houston area. Harris Health is our safety net, as the premier safety net for the Houston community. So we're here to help and serve our Harris County patient population. So everyone's probably familiar with Bentop, and now they'll be familiar with LBJ because we will be expanding our facility in 2028.
Oh wow, that's great.
Exciting. Yes.
That is great. Now, why did Harris Health System decide to partner with HCC on this apprenticeship program?
As Dr. Robinson mentioned earlier, we have some partnerships with them in the past. In my opinion, I believe that Houston Community College is aligned with our mission of improving the healthcare within Harris County. And it always starts with students. Students is our future. So she mentioned a lot about upskilling our internal employees and offering opportunities from day one with external students within the community. So I think this is a great partnership. We worked with them in the past with a PCA program. So this is going to be a great opportunity for us with them.
That's great. Now, besides patient care technician, are there any other healthcare occupations you would like to see added to the REACH apprenticeship program in the future?
Hi, I'm sorry.
Oh, you're all right, Elle? Can you hear me?
Yes, I can hear. I'm sorry. For some reason, I lost you. I apologize.
Okay.
But your question you asked is what are the programs that we're looking into for apprenticeship program?
Yeah, what would you like to add to it in the future?
Yes, sir. I would have to say facilities engineering. I'd like for us to explore non-clinical roles. We're starting first with the PCA role, but I'd love for us to explore non-clinical roles such as IT, food and chef roles. They have apprenticeship programs for that. Facilities engineering, like I said, and there's probably other opportunities that we can explore that are non-clinical roles. On the clinical side, I'd love for us to look at endoscopy techs, surgical techs, sterile processing techs, and various other ones that we can explore, like LVNs or even medical assistants.
Great. So you want to cover the whole gamut of everything. That sounds good.
Yeah, we're growing, and with the expansion for LBJ, this is the beginning of a beautiful partnership. As Dr. Nicoteri explained, it's a marriage. So this is going to be very exciting for us.
It's a marriage and we still in love. How about that?
It started yesterday, signing of the MOU. So this is very exciting. Thank you.
Right. That's great. That's great. Now, Reed, I don't want to leave you out. From a talent side, why did Harris Health System feel that it was important to first start producing more patient care technicians?
Yeah, well, Paris, good afternoon, and thank you for having me on your show today. The patient care technician is a natural entry point into the healthcare field. So as you start thinking about the levels of service providers that are offered, patient care technicians is one that we felt was a entry point that offered the right amount of experience in the apprenticeship, and it offered the right amount of opportunities for those inside of our organization and outside of our organization. We really look at it as a career entry point, and we thought that partnering with HCC made a lot of sense for us from an organizational perspective. And so patient care technicians, we have a lot of positions open here at Harris Health System, and so it made sense to start with the patient care technician.
Now, what impact do you believe this apprenticeship will have on non-clinical employees, who want to maybe start a promising healthcare career?
Well, I think it can be life-changing, Paris. I think that there are lots of people who come to work or who are out there in the community who want to start in a career in healthcare. And I think that this apprenticeship gives them that opportunity to start that career. We know that jobs change lives. And so our ability to create those jobs and to create this apprenticeship has the ability to transform lives. We've had some other programs with HCC, and we've seen those persons come into our organization and they've started their career and they've been able to progress past where they were at the entry level. And so we know that financial stability helps to change the outcome for generations if we can help provide it. And Harris Health is very excited to be able to provide those opportunities.
That's good. My battle cry is if it doesn't make dollars, it doesn't make sense.
Absolutely. Absolutely.
Now, how do you think this partnership will impact your recruiting efforts and, more importantly, your quality of patient care?
Well, I think it opens up a whole new pool of people who we previously did not or were not a part of our recruiting pool by being able to partner with HCC. Unemployment is pretty low right now. And so this gives us an opportunity to find a new group of people who may have been historically overlooked and maybe not had an opportunity. I like to say success is where opportunity meets preparation. And no matter how much preparation you do, if you don't get an opportunity, you're not going to be successful. But no matter how much preparation you do, if you don't get an opportunity, you also won't be successful. So we're excited to offer this opportunity, and I think it will impact our recruiting in a very positive way. And it certainly will help us increase the patient care. Patient care is a one-on-one relationship type of thing. So the more people that we have are able to provide services to those patients, the better off we are. Right now, we find sometimes that we are we find ourselves at levels that we're not comfortable with in taking care of patients. And so this will help us get to those levels much quicker by being able to add these PCTs to our staff through this apprenticeship program.
Great. Stay ready so you ain't got to get ready.
Absolutely.
Sounds good. He is Harris Health Executive Vice President and Chief People Officer, Omar Reed, and she is the Director of Talent Acquisition, I want to say her name properly, Palugna. Did I do that right?
Yes, you did great. Thank you.
Hey, listen, thank you guys so much. And thank you guys for helping out. Thank you guys for the great work that you put in, because I know it's a lot of work to put these partnerships together. And more importantly, it's a lot to maintain them. So thank you both. We really appreciate you.
And we want to thank HCC for all the work, Dr. Nicotera, Dr. Robinson, and everybody else who participated in this. So thank you to all of those persons. And we look forward to getting it kicked off in January.
Sounds good.
All right.
Thank you so much. And thank you for joining us on the topic. For more information on this partnership and how you can be a part of it, visit hccs.edu/podcast. That's hccs.edu/podcast. For the topic and all of the phenomenal people that help put this show together on HCC TV, I'm Parrish Murphy. You take care.